All right, let's talk about a really common cause of some serious shoulder pain.
So what is it? Well, for a lot of people, it's these tiny little calcium deposits.
And it's surprisingly common. We're talking about 7% of folks with shoulder pain.
This stuff usually builds up in one specific spot, your supraspinatus tendon.
So to really see what's going on, your doctor will likely start with an MRI.
And what's really cool is how these different scan settings can make that calcium deposit pop. You see that really dark spot right there? That is the classic sign on an MRI. The scan also shows inflammation around it, and that's usually where the real pain is coming from.
But here's the catch. The MRI tells us where it is, but not what its texture is.
For that, we need a different tool. Let's see what an ultrasound can show us. Ultrasound can tell if it's soft like toothpaste or hard like a pebble. A huge difference.
Okay, so this is a hard deposit. See how it's bright white with that dark shadow? Soft deposits, though, look kind of fuzzy and are often surrounded by some serious inflammation.
And this is usually when it hurts the most, because your body is trying to fight it.
So why does this soft versus hard thing matter so much?
Well, it completely changes the treatment.
For example, a procedure called lavage works great on those soft deposits. You can literally wash them out.
So to recap, MRI finds the spot, but ultrasound tells us what it's actually like.
So getting the right picture really is the first step toward getting some relief.